Good afternoon. My name is Chad Lefteris. I'm the Chief Executive Officer at UCI Health. While we're located up in Orange, we take our role here in Orange County to be very important, and we serve all of the county, including the wonderful population here in Irvine. It's my privilege to stand before you today and give you a few insights into what we're working on across the campuses. And I'd like to start with letting you know that as the county's only academic medical center, we were made for this exact moment. We plan, we practice, and we drill for surges and for pandemics. We don't always know what is going to cause that surge, but we plan for this. And I want you to know that you're in very good hands because of that. We started tracking this pandemic when it was on the other side of the globe many months ago. We stood up our preparations as early as late December to prepare for the worst and hope for the best. We continue to work very closely with our colleagues across the entire county and to make sure that we're in lockstep with the latest information that's coming out, both nationally and internationally, to make sure that our caregivers are as well versed in everything that is happening. You may wonder, what is it like to be an academic medical center? And what does that mean to the community? And there are several great examples. One is our access to clinical trials. Just today, we're one of several centers who are participating in an interesting NIH-sponsored clinical trial, which is going to bring very important information, very early information, but promising information as it relates to the treatment of these patients. That's something that only an academic medical center can do, and you have that here in your backyard. We're also partnering with our colleagues on campus, here on the main UCI campus in Irvine, to create 3D printed face shields and other things that are very hard to get today via the normal inventory or supply lines. And so we're able to partner with colleagues, brilliant colleagues on campus that in a matter of days created an amazing resource for us. And we've shared these with other hospitals that we know are short on supply because they're so hard to get. So you should be aware that we also have testing available for patients or loved ones who may require it. Anyone can get a test to see if they're COVID positive. There is a nurse triage line to call, and I'm going to read out the phone number because I want to make sure that you have it. Again, to call the nurse triage line, it's 949-824-8600. Again, 949-824-8600. That's the UCI Health nurse triage or testing line. They will walk you through several questions to screen you for testing. And you may wonder, why do I need to be screened? I just want to get tested. The reason why we need to screen you for testing is that, unfortunately, while we have an amazing ability to test now versus what we had when this event started just now a few weeks back, we still have limited resources, and all of our supply lines across all the healthcare settings are really challenged. So we want to go through the screening to make sure we're testing the right people, not just everyone quite yet. At UCI, we were the first in the county to be able to do in-house testing. We're very proud of that because it took a lot to turn that on quickly, and we're very proud of our laboratory teams for doing that so fast. That means today we can test close to 1,000 people a day, but again, we want to make sure that we're utilizing our resources very tightly and making sure that we're testing those that are in need. Coming out next week is the next phase of testing. You may have heard about it in the news. It's the antibody or serologic testing, the blood test. That's going to be very important information as we go into the next wave of this surge or the next wave that's coming in the fall. We don't know. So having these additional testing platforms is going to be extremely important to the health of the overall community and planning ahead. So again, we continue to meet the testing demands of the local community as well as other healthcare providers. They've called on us to ask them to provide testing for their coworkers that may have been impacted or other patients. So we're very grateful and happy to do that for others, and we see that as a role in as our role within the community. We do have 2 sites. Once you go through the screening, you can drive-through testing that's available, and that's located here at the main UCI campus at the Gottschalk Medical Plaza here in Irvine. As well as we have another drive-through testing site located up at our Orange Medical Center main campus as well. So as you go through, they can direct you to one of those two through the nurse triage line as well. And the final thing I'd like to say is really thank you to the entire community for supporting us, but also I would be remiss if I didn't say thank you to our staff. They are fighting this fight every moment of the day, and this is hard work, and they are at it. and they are running to the fight, actually. So I couldn't be more proud of the work that they are doing, all of the caregivers that are working tirelessly to make sure that we're protecting our community. So thank you very, very much. Have a great afternoon.